Okay, I don't look the best because I'm not feeling very well. And this is a tutorial on how to do ports and pick lines. I don't do mine as much anymore, but then, with autoimmune problems, your health does weird stuff. So anyway, this is a 20 gauge Huber needle, and they're yellow. The 22 are black. It's an inch long because it depends on how deep or long you need your needles to be. They range in all different sizes. Most hospitals have them 1.5 to 2 inches. And they come in little packages. Everything comes packaged with this. And this is your port kit. And it has in it a mask, a pair of wrapped gloves, a 13 by 19 inch wrap. I'm doing this thing on my camera, you're screwing it up. And ChloraPrep's step 1 insert, and ChloraPrep step applicator, a tape measure for some, I don't know why they put a tape measure in there. Gauze sponge 4 by 4 inches, gauze sponge 2 by 2 inches, non-adhesive dressing 2 by 2, non-woven slit sponge 2 by 2, roll of tape, transparent dressing, and also those Tegaderm things, whatever they're called. But at any rate, it should have in it tape, like I said, but they don't have very much tape. Actually, you can collect these and make yourself a roll of tape. A mask that builds up in my house. Gloves, like sterile gloves, and these things that usually your dentist puts on you as a bib, but you can use them to lay out all your dressings on. So they're about like that big. They're pretty good size. Two alcoholic things in non-medical language. This little thing that sponges and cleans the area you're about to stick yourself with. To be honest, after a while, the sticking yourself doesn't really hurt you anymore. And this is what they mean. And this is just your gauze that comes with it. And this is the one with the hole in it, to support so you don't get tape bothering you. And this extra in case you bleed, for whatever reason. They give you two. And then, Tegaderm. They're about that big. I preferably like them to be smaller, but beggars can't be choosers. So anyways, then you want to lay it out. So you've got all your stuff in a row, minus the tape measure, because I don't use that. And basically what you want to do is you want to have they're made by Braun, they're sterile end caps. And anytime you get your blood drawn or something like that, you need to change them. Or they need changed for veritable reasons. There's a lot of reasons why you would change them in a hospital setting. Not so much at home, but in the hospital. So I'm going to start like this because I don't have to wear a mask. Also have a mirror because you can better see what you're doing. Like this is my mirror. And also this is my lovely little tray down here. Okay, to get started, you're gonna need to take this off of this and this off of this because it's all plastic and you're gonna have to twist it off. And with my rheumatoid problems, I don't like twisting things some days. And then you need your little sodium flushes. Like I also like to use heparin, you know, because I use it to seal it as well as open stuff a little more. In any which way, it's a blood thinner, especially heparin top. It's the Kung Pao stuff you can get in the means of heparin. And then basically what you kind of want to do with your needle is twist it on like this, make sure it's nice and then we get this in camera. Squeeze it, see, and then it works. There's no hole or anything in there. And then you just set that nicely aside. Unfortunately, now I'm going to have to do my mask because you don't want to breathe on this. It has to be sterile, everything. Let's see. I try to keep my trash in a neat pile, and that way I can throw it all away. And then the first step of sticking yourself, you want to make sure this gives out alcohol, which it does. Mine is right here, if you can see the scar anymore. You can see it when I lean back. Now I'm going to have to use my mirror because I can't see what I'm doing. And basically, you just kind of rub it down like that, make sure it's nice and clean a couple good times. This also works for cleaning other surfaces when you're done, which is kind of gross. But then if you shower, it's not really that gross. You can clean with it if you're... Because I used to get them in swabs and I could clean my keyboard. Handy dandy little accessory. Okay, and this little end piece comes off. You want to be sure to stick yourself at a 90-degree angle, not going this way or that way, straight in, and don't hit the bottom. And if you stick yourself wrong and then inject yourself, it all goes right to the top of your skin and it burns. Then you have to like push on it to get the water out. I've had that happen before. It's not very fun. Can't see. I can't see up. Can't see if this nose thing. first one, you should feel where the middle is if you're a first timer doing this. Feel where your middle is. And let's see. And I found it. You can also taste and smell the hip, smell the different stuff. Now that's good. Now what we're gonna do is just leave that on there. Better yet, clamp it off and rotate it up. Because you really shouldn't take off your mask until you're done with your Tegaderm thing. I'm not going to flash. Okay. So I used to do this weekly. Yeah, all stuck. Hate wearing a mask. And then you just peel. Right on off. There we go. And let's see, before you start also, you should have your heparin ready and you should have your IVs ready. And that's pretty much it, other than starting the IV, which is basically screwing this end cap into the other. And like, you get better IV runnage if you run it up over your shoulder. And that's it.